So you have read different cranial fossas, and so we will summarize today all the foramens we will discuss. Okay, foramens, different foramens of the cranial cavity. So foramens are mainly is the opening inside the body that allows the key structure to connect one part of the body to the another. Okay, we have foramens in various bones of our body, such as vertebral column, pelvis. Here also you have seen vertebral foramens, intervertebral foramens, all those. But predominantly there are more foramen in the skull. Okay, so foramens are located in these bones mainly. These are around 21 foramens in the human skull, and the skull bones in which the foramens are embedded are these: frontal bone, ethmoid, sphenoid, maxilla, palatine, temporal, and occipital. Okay, so this one is frontal. Here will be the ethmoid, sphenoid, temporal, occipital. Okay, palatine will be near the nasal cavity. So we are starting from frontal bone. Okay, frontal bone, first foramen is the supraorbital foramen. Here is the location of supraorbital foramen. It is a small groove at the superior and medial margin of the orbit in the frontal bone. The superior margin of the orbit at the junction between lateral 2/3 and medial 1/3 of the supraorbital margin. Okay, and what are the structures passing? Supraorbital nerve, which is the terminal branch of frontal nerve, passes through this supraorbital foramen. Okay, understood? Next we are going to foramen cecum. Okay, foramen cecum is lying here in between the crista galli and the frontal crest here. Crista galli is part of ethmoid bone and frontal crest is part of the frontal bone. Here is location of the foramen cecum. It is located anterior to the cribriform plate, and crista galli lies at the median plane of the cribriform plate. Okay, cribriform plate is sieve-like structure, and the cribriform foramens gives passage to the olfactory nerves. So this foramen cecum, it transmits the emissary vein from the nose to the superior sagittal sinus. Okay. Next we are going to the ethmoid bone, foramen of cribriform plate or olfactory foramens. Okay. Cribriform plate forms the roof of the nasal cavity, and olfactory foramen are in two depressed areas on each side of the median plate. Median plate is the crista galli. Okay. And this allows olfactory nerves to pass through, enter into the olfactory bulb from the nasal cavity. Next, we are going to anterior and posterior ethmoidal foramen. Okay, they are situated lateral to the olfactory foramen in this location. From the nasal cavity, they are more clearly visible. Okay, anterior and posterior ethmoidal foramens. They are situated lateral to the olfactory foramen. Anterior foramen, anterior ethmoidal foramen transmits the anterior ethmoidal artery, vein and nerve. And posterior ethmoidal foramen transmit posterior ethmoidal vessels and posterior ethmoidal nerve. Next is sphenoid bone. In the sphenoid bone, you will see superior orbital fissure. Very frequently as superior orbital fissure. It is situated in between the lesser wing and greater wing of the sphenoid. This is view we are seeing from the orbit. Okay, it is located near the apex of the orbit. So this is optic canal. This is superior orbital fissure. Here is the inferior orbital fissure. Okay. So you can see this part, this yellow portion. It is formed by the sphenoid bone. This is lesser wing of sphenoid and this is greater wing of sphenoid. Okay, this is frontal bone. Here is the ethmoid bone. This is maxilla and this is zygomatic. So all these are forming the different walls of the orbit. And in this view from the orbit, in the medial wall, you will see the ethmoidal foramens. Here is location of anterior and posterior ethmoidal foramens. Okay, in the medial wall of the orbit, you will see those. Superior orbital fissure, it is situated in between lesser and greater wings of the sphenoid. lesser wing and greater wing. In between it lies the superior orbital fissure, and it gives passage to these multiple structures. Third, fourth, sixth cranial nerve, oculomotor, abducens nerve, and ophthalmic division of the trigeminal nerve, ophthalmic veins, and sympathetic fibers from the cavernous sinus, which was lying around the internal carotid artery. Some fibers from this also passes through this superior orbital fissure. Okay, so these are the structures passing. Since multiple structures pass through this foramen, can be damaged in orbital trauma, particularly in blowout fracture. In case of fracture of the orbit, these important nerves and vessels are damaged in case of injury to the superior orbital fissure. Okay. Next, we are going to inferior orbital fissure. See, this one is the inferior orbital fissure formed by both the sphenoid and maxilla. Okay, here this yellow portion is the sphenoid and the green one is the maxilla. So this foramen is lying between the sphenoid and maxilla at the junction of lateral wall and floor of the orbit. Okay. So located along the boundary of floor and lateral wall of the orbit and transmits these structures. Zygomatic nerve, infraorbital nerve, these are branch of the maxillary nerve. Infraorbital vessels and inferior division of the ophthalmic nerve, all this passes through this infraorbital fissure. Okay. Next we are going to the optic canal. Here is the location of optic canal. Located in the sphenoid bone, bounded medially by the body of the sphenoid and laterally by the lesser wing of the sphenoid. Here medially will be the body, laterally is the lesser wing of the sphenoid. And it transmits the optic nerve and ophthalmic artery into the orbital cavity. Okay. Next we are going to the foramen rotundum. Okay. We are going to the middle cranial fossa. Here foramen rotundum, foramen ovale, foramen spinosum. Okay. These three we will discuss now. So first is foramen rotundum, located inferomedial to the superior fissure at the base of the greater wing of sphenoid. Here is the location of superior orbital fissure. So this foramen rotundum is inferomedial to the superior orbital fissure and it allows passage of the maxillary nerve. Okay, second division of the trigeminal nerve. Ophthalmic was passing through superior orbital fissure. Maxillary is passing through this foramen rotundum, and which is a second branch of the trigeminal nerve. Next, we are going to foramen ovale. This opening is foramen ovale. It is opening in the greater wing of sphenoid and it is lying posterolateral to foramen rotundum. This is rotundum. Ovale is lying posterolateral to the rotundum. And what are the structures transmitted through this rotundum? You can remember male structure from these first words. Okay. M is the mandibular nerve, which is the third division of the trigeminal nerve, mandibular nerve. Next is accessory meningeal artery, lesser petrosal nerve and emissary vein. These four structures are passing through foramen ovale. Okay, male structure, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. Very frequently asked in your viva. Okay, superior orbital fissure, optic canal, this foramen rotundum, ovale, spinosum, all these are asked in your bones viva. Okay. Next are spinosum. Foramen spinosum is opening in the greater wing of the sphenoid, posterolateral to ovale. This is foramen spinosum, posterolateral to the foramen ovale, and allows passage of the middle meningeal artery and vein and meningeal branch of the mandibular nerve. Okay, so these are the structures. Middle meningeal vessels, artery and vein, you can remember like vessels, and meningeal branch of the mandibular nerve. Okay. Mandibular nerve was coming out through foramen ovale and it is giving a recurrent branch to supply the dura mater which was entering through the spinosum. Okay, foramen spinosum. Clinical significance, it is used as an anatomical landmark during different nerve surgery, this foramen spinosum, and also be relevant in achieving hemostasis during surgery by ligation of the middle meningeal artery. Okay, Middle meningeal artery is passing through this foramen. So if you want to ligate this artery during some surgery, you have to locate the artery here. Okay. Next is foramen lacerum. Here near the apex of the petrous temporal, here is the foramen lacerum. Okay. So it is a triangular hole in the base of the skull located between three bones. Sphenoid bone anteriorly, this part is body of the sphenoid, and this here is the greater wing of the sphenoid. Sphenoid bone anteriorly, apex of the petrous part of temporal bone posterolaterally. This part is the apex of petrous part of the temporal bone, and basilar part of the occipital bone posteromedially. Here lies the basilar part of the occipital bone which joins with the basis sphenoid, and it transmits many structure including greater and deep petrosal nerve which merge to form nerve of the pterygoid canal. Posterior opening of the pterygoid canal is located here, okay, in this foramen lacerum, and anterior opening in the pterygopalatine canal. So here these two nerves are joining greater and deep petrosal nerve to form nerve of the pterygoid canal and passing through the pterygoid canal to the pterygopalatine fossa. An artery of the pterygoid canal is also lying here. Okay. So foramen lacerum, its clinical significance, it is a portal for entry for removal of tumors such as naropharyngeal carcinoma, adenoid cystic tumor, and juvenile angiofibroma. For all those tumors, operation is done through this entry. Okay, foramen lacerum. Next, we are going to the maxilla. Here we are getting inferior orbital fissure. We have already discussed inferior orbital fissure. Next, we are going to incisive foramen. Here, this is location of incisive foramen in the hard palate. Okay, the anterior part of the hard palate, posterior to the this incisor teeth. Okay, so opening of the incisive canals on the hard palate behind the incisor teeth is known as incisive foramen, and it is situated within the incisive fossa of the maxilla. Okay, and structure passing through this are the pterygopalatine nerves, nasopalatine nerve, infratrochlear nerve, which is a branch of ophthalmic nerve, and sphenopalatine artery and vein. Okay, so these are the structures passing through the incisive foramen. Next, we are going to the incisive foramen. Its clinical significance. It is used as a landmark when describing the cleft lip and cleft palate, and which can extend either in front of or behind the foramen. Okay, cleft lip and cleft palate, it extend is measured from the location of the incisive foramen. And as many nerves exit this foramen, okay, nasopalatine, sphenopalatine, all those nerves are passing through this, and it may also be used for injection of local anesthetic in dental surgeries. Okay, these nerves are blocked near this foramen. Next, we are going to palatine bone. Here is the location of palatine bone. Here is one vertical plate and one is horizontal plate. Okay, so there are greater palatine foramen. See here, this is the location of greater palatine foramen. Okay, greater palatine foramen gives passage to greater palatine nerves and greater palatine vessels, and lesser palatine foramen is located posterior to this greater palatine foramen. Here, the small foramens are lesser palatine foramen, and they give passage to the lesser palatine nerve. Okay. Next is sphenopalatine foramen. Okay. Here is the location of the sphenopalatine foramen. Sphenopalatine foramen connects the nasal cavity. This is nasal cavity, lateral wall of the nasal cavity. So this through this foramen, nasal cavity is connected to the pterygopalatine fossa. So its sphenopalatine foramen connects the nasal cavity with pterygopalatine fossa and formed by both the sphenoid and palatine bones. Okay, and it transmits the sphenopalatine artery and vein and posterior, superior, lateral nasal nerves. So these are the structure passing through this sphenopalatine foramen. Next, we are going to the temporal bone. In the temporal bone, petrous part of temporal bone, there is carotid canal. Here, you can see this opening. This is opening of the carotid canal. Okay, one opening is here, another is near the apex. Okay, L-shaped canal is there. So, located at the petrous part of temporal bone in the middle cranial fossa and allows internal carotid artery to enter the middle cranial fossa from the neck. From the neck, it enters through this foramen, then comes out through the apex of petrous part of temporal bone, and then it lies on the two sides of the body of the sphenoid in the carotid canal. Okay, and so it allows internal carotid artery to enter the middle cranial fossa from the neck, and both the internal and external openings of the canal are located anterior to the jugular foramen. Okay, here is the location of jugular foramen. So both the openings are lying anterior to this jugular foramen. Okay. Next we are going to jugular foramen. Jugular foramen is located behind the carotid canal and one of the large foramen of base of the skull. Here is the jugular foramen. And it is formed in front by the petrous part of temporal bone. This yellow colored one, this wedge shaped structure is the petrous part of the temporal bone. And here is the lateral parts of the occipital bone. So the jugular foramen is lying in between the petrous part of temporal and lateral part of the occipital bones. Okay, so it is located behind the carotid canal, one of the large foramen in the base of the skull, formed in front by the petrous part of temporal bone and behind by the occipital bone. And it is subdivided into three compartments: anterior compartment, anterior, intermediate, and posterior compartment. So anterior compartment gives passage to inferior petrosal sinus. Okay, which is lying along the inferior margin of the petrous part of temporal bone, and intermediate part gives passage to 9, 10, 11th cranial nerve, glossopharyngeal, vagus, and accessory, and spinal accessory nerve. And posterior compartment, it gives passage to internal jugular vein, ascending pharyngeal artery, and meningeal branch of the occipital artery. Okay, so all these are structures passing through the jugular foramen. Okay. Next, we are going to internal auditory meatus or internal auditory canal. Here, okay, this is the location of internal auditory meatus or internal auditory canal. This canal is within petrous part of the temporal bone. Okay, in the posterior cranial fossa. Between the posterior cranial fossa and inner ear, it is located, this canal, connecting the posterior cranial fossa with the inner ear. And it provides passage to the vestibulocochlear, that is 8th cranial nerve, facial nerve is 7th cranial nerve, and labyrinthine artery. Okay. So these are the structures: 7th, 8th, and nerve, cranial nerves, and labyrinthine artery supplying the labyrinth of the inner ear. Those are passing through this internal auditory meatus, okay, or internal auditory canal. Next, we are going to stylomastoid foramen. Here, in between the styloid process and mastoid process lies this stylomastoid foramen. Foramen between the styloid and mastoid process of the temporal bone, and it transmits the facial nerve and stylomastoid artery. In case of inflammation of the facial nerve in this foramen causes Bell's palsy. Below, after coming out from this foramen, if injury occurs to the facial nerve, it will lead to Bell's palsy. Okay, we have already discussed. Next, we are going to the occipital bone. Okay, occipital bone, first foramen, larger foramen is the foramen magnum. This foramen is very frequently asked in your viva, structure passing through foramen magnum. Okay, very important. It is large oval shaped opening in the occipital bone of the skull. This is foramen magnum, an important structure in bipedal mammals. It is the second largest foramen in the body. First one is the obturator foramen. obturator foramen lying in the hip bone, and the alar ligament attached on each side to the tubercle of the occipital condyle divides this foramen magnum into anterior smaller and posterior larger compartment. Here are the two tubercles. These tubercles are joined by the alar ligament, okay, and this will divide the whole foramen into anterior smaller part, posterior larger part, and it transmits a number of important structures between the neck and the neurocranium. Neurocranium means brain, okay. What are the structures? So through the anterior compartment passes the apical ligament and tip of the dens. Dens means projecting part of the atlas, okay, axis vertebra. Second cervical vertebra has a projecting part which is acting as a pivot, okay. So that part, tip of the dens, and at this tip attached this apical ligament, they are passing through foramen magnum, and cruciate ligament of the atlas and membrana tectorium. These are passing through anterior compartment. Next, through the posterior compartment passes the lower end of medulla oblongata, which continues downward as the spinal cord. The spinal cord, the vertebral artery, okay, accessory nerve, the anterior and posterior spinal arteries, and tonsil of the cerebellum. All these are passing through the posterior compartment, okay. Next, so we have completed foramen magnum, okay, its structure passing through foramen magnum, very important. Next is hypoglossal canal. It is hidden medially and superior to each occipital condyle, okay. Here is the hypoglossal canal, location of the hypoglossal canal, hidden medially and superior to each occipital condyle. These bluish colored ones, these are the occipital condyles. So this hypoglossal canal is superior to this occipital condyle, okay, and it transmits the hypoglossal nerve, 12th cranial nerve. Next is condylar canal. Condylar canal is present in lateral part of the occipital bone behind the occipital condyle. Here, posterior to this occipital condyle, here is the location of the condylar canal. Okay, it gives passage to emissary veins mainly. Okay, so these are the important canals and foramens. So now you come here, I will show you the. So we are starting from frontal bone. In the frontal bone, along the superior margin of the orbit, here, this foramen is the supraorbital foramen. Supraorbital notch is converted into foramen in maximum cases, and it gives passage to the supraorbital vessels and supraorbital nerve. Okay. Next, here, this is foramen cecum. This foramen you can see here, this is foramen cecum, okay. It is lying in between the, this is foramen cecum. Here is the foramen cecum, okay. It is lying between the frontal crest in front and this crista galli behind, okay. So this is foramen cecum. It gives passage to emissary veins connecting superior sagittal sinus is starting here and the nasal veins. And here on two sides, on the two depressions on the sides of this crista galli, here is the cribriform plate, okay, cribriform plate of the ethmoid bone. Here is the cribriform plate of ethmoid bone, and the foramens lying in this cribriform plate of ethmoid bone, this gives passage to the olfactory nerves, okay, olfactory nerves. Next, here from this orbit is anterior ethmoidal foramen, okay, understood? Here anterior ethmoidal foramen, here is the posterior ethmoidal foramen, okay, dekha geche. Next we are going to the sphenoid bone, okay. Sphenoid bone, see, this one is foramen rotundum. Here is the foramen rotundum. On this side, this one, okay, foramen rotundum. Through its maxillary nerve is passing through foramen rotundum. Next is, this one is foramen ovale, okay, foramen ovale, male structure, mandibular nerve, accessory meningeal artery, okay, lesser petrosal nerve and emissary veins, all are passing through this foramen ovale. This one is foramen ovale.
posterior to this foramen ovale, this is foramen spinosum. Okay, here is the foramen spinosum. You have seen foramen spinosum, and this large foramen. This is petrous part of the temporal bone. This large foramen near the apex of the petrous part of temporal bone. Here is the foramen lacerum. Okay, foramen lacerum. Here is the location of foramen lacerum. Next, you see here in the petrous part of temporal bone, this foramen in the posterior cranial fossa. This is internal auditory meatus, where the tip is entering. This is internal auditory meatus, okay, or opening of internal auditory canal connecting posterior cranial fossa with the internal ear, okay. Next, this large foramen here, just at the junction between the occipital, lateral part of the occipital bone and this petrous temporal. This large foramen is the jugular foramen. Okay, it has 3 compartment structures are passing through these 3 compartments here. Here is the jugular foramen. Okay, দেখা গেছে? Jugular foramen on this side, this one. This one is jugular foramen. Okay. And here just above the occipital condyle, here through which it is coming out, this is hypoglossal canal. Okay, this is hypoglossal canal, and through which comes out the 12th cranial nerve, hypoglossal canal. And here posterior to the occipital condyle, this is condylar canal. Okay, condylar canal, opening of the condylar canal. And see, this is jugular fossa. Here near the jugular foramen, this depressed part, this fossa is known as jugular fossa. Just in front of this jugular fossa, this opening is for carotid canal. Okay, this is posterior opening of carotid canal. Through it enters into the cranial cavity, and through, you can see through the apex of the petrous temporal, it is coming out, and then it will lie on the side of this sphenoid bone like this. Okay, it is entering through this opening of the carotid canal, posterior opening, and then come out through the anterior opening at the apex of petrous temporal. Then it is lying on the 2 sides of the sphenoid, body of the sphenoid in the carotid canal. This part is known as carotid canal. Okay. Okay. And here is the stylomastoid foramen. This one, stylomastoid foramen lying between the mastoid process and styloid process, and this is external auditory meatus, external auditory meatus. Okay, and this is greater palatine foramen, and this is lesser palatine foramen. Greater palatine foramen, lesser palatine foramen, and this is incisive canal. Okay, and this is infraorbital foramen, okay. Rotundum তো এখানে sphenoid, greater wing of sphenoid, rotundum, ovale, spinosum, 3টে পরপর থাকে এখানে। কোনটা? ওটা তো foramen lacerum, এটা lacerum, rotundum, ovale, এটা spinosum, lacerum। হ্যাঁ, এই যে এখানে যেটা এখানে অ্যাপেক্সের ভিতরে ঢুকে যাচ্ছে ওইটা ক্যারোটিড ক্যানাল। এই যে এখানে যাচ্ছে আর এই দিক থেকে ওপেন হচ্ছে, এই যে এখান থেকে পাস করলে যেটা ওইদিকে বেরিয়ে আসছে, এটা হচ্ছে ক্যারোটিড ক্যানাল। ওকে, আন্ডারস্টুড? ওকে, এগুলোই আছে। আর কিছু কোয়েরি আছে? ইউস্টেচিয়ান টিউবের অনলি it is not completed here, and only bony part is visible. Okay, here this is the location of bony part of the eustachian tube ekhane. Okay, connecting the ekhane nasopharynx hobe, nasopharynx with the middle ear is lying within this petrous part of temporal bone. At it location of this eustachian tube is at the junction between greater wing of sphenoid and petrous part of temporal bone. Eta petrous part of temporal, this is greater wing of sphenoid, so this is location of the eustachian tube. Okay, understood? Any further queries? আর ম্যান্ডিবেলের গুলো তো দেখানো হয়েছে ম্যান্ডিবেলের সময়, ঠিক আছে? ওকে, দ্যাটস অল। নাকি দেখবি ম্যান্ডিবেলের গুলো? এটা রুটেন্ডাম বললাম। হ্যাঁ, এটা রুটেন্ডাম। এই তো ম্যান্ডিবেলের তো এই যে মেন্টাল ফোরামেন, mandibular foramen. Okay, আর কিছু নেই সেখানে, mental foramen, and this is mandibular foramen. Okay,